How well does the BCG vaccine protect against active TB disease? Imagine a vaccine that helps protect young children from the most severe forms of tuberculosis. That's what the Bacille-Calmette-Guerin vaccine does. It offers moderate protection against active tuberculosis in young kids, especially preventing dangerous cases like TB meningitis and disseminated TB. These are serious illnesses that can cause lasting damage or even be life-threatening. In children under 5, BCG reduces the risk of developing active TB by about 37 to 50%. That means fewer young children get sick from TB, and those who do are less likely to have severe disease. This protection is especially important because TB in young children tends to be more aggressive and harder to treat. However, as children grow older and become teenagers or adults, the vaccine's effectiveness drops significantly. In these age groups, BCG shows little consistent ability to prevent pulmonary tuberculosis, which is the most common form of the disease and the main way TB spreads from person to person. This means that while BCG is great for protecting young children, it doesn't reliably stop older individuals from developing active TB or transmitting it to others. The protection in older age groups is often minimal or varies depending on where you live, likely due to factors like exposure to environmental mycobacteria or genetic differences. Another interesting aspect of BCG is that it seems to offer some nonspecific health benefits. Some studies suggest that vaccinated infants may have lower rates of death from other respiratory infections and sepsis. This might happen because BCG can train the immune system to respond more strongly to various pathogens, not just TB. This phenomenon is called trained immunity, where innate immune cells are reprogrammed to be more alert and responsive. It's also important to note that protection from BCG can fade over time. The vaccine's effectiveness can decrease as years go by, which is why booster strategies are being explored. Researchers are working hard to develop new vaccines that could provide better, longer-lasting protection for all age groups, especially in areas where TB is common. In summary, BCG is a valuable tool for preventing the most severe forms of tuberculosis in young children. It reduces the risk of active disease in this vulnerable group but offers limited protection for adolescents and adults. Because of this, health authorities continue to recommend BCG vaccination for infants worldwide, but they also emphasize the need for new, more effective vaccines to control TB across all ages. If you or your loved ones are concerned about TB, it's always best to consult healthcare professionals for personalized advice and to stay informed about ongoing advances in TB prevention.